Hey everyone, welcome back to my YouTube channel. Welcome to my YouTube channel. My name is Abigail. That was my dog that just hit the wow. Anyway, I show what it's like as a teenage girl to live with lupus and POTS and an undiagnosed autoimmune, which is great because I don't. It's a whole story. Anywho, my last video was a Rihanna. My last video was supposed to be prom. I didn't film a lot, and by the time I was going to go and edit it, I was just like, whatever. I left early just because I had already, we went to, we had pictures and then dinner, and dinner was we were put in the middle of the room in a very loud restaurant, and I was already overstimulated before we went, and so it just I'm gonna leave. That's the dog, and then the other noise is the dryer. And I've been sick, while at prom, I was also sick. I had a bladder infection, which is something that can happen with lupus. It's very common. I had one last year, but this one, it's every 15 days I get sick, and then the next day I start having cramps where my bladder is, and that has been going on 3 times now. That's 3 times. And each time, it'll show up as UTI or bladder infection, or there's bacteria. It's contaminated each time. So today I'm going to the urologist. Hopefully he can help, or she. I don't remember who I'm seeing. This is a whole new doctor for me. I've been to a urologist before, but I have not been to this urologist. So that is going on, and then we go to a kinesiologist, which is kind of like a holistic doctor, and he's amazing. Found out that my dad had stage 4 Lyme disease. Why do you have to keep touching me? My dad wasn't able to walk, and he helped, and before all this started, he was like, you have inflammation in your brain. And then I got an MRI 3 months later, and in fact my brain was inflamed. Lord have mercy. And he was like, yeah, you have a UTI and you need to get antibiotics for that, which I've had 2 different antibiotics for it, because I can't have half the antibiotics because it either has milk in it or it has 2 medications in it that actually there's 3 medications that I can't have, but 2 of them usually is in and antibiotics, so I can't have it. So hopefully I can get medication for this. And then he was like, you have a parasite. So we're working through that. That's probably what this whole video is going to be about, and it's kind of lame. So this year I'm going to be a senior, and there's a lot of things that I do this year. I signed up for the SAT in August. But also, I'm going to learn how to sew because I have a graduation dress that I really want to wear, but I did not want to pay that price for it, and also I could not find it on a reliable site. So I'm making it, and it's not going to be the exact same, but it's going to be inspired by it. So I'm learning how to sew. I have some of the pieces cut out, and I halfway know how to sew, halfway don't, so I'm getting somebody else to help me with that. So there might be some updates about that, because I do want most of the things for my senior year to be made by me. So my cap, my school is allowed to decorate their caps. So I'm gonna decorate my cap, and then my dress isn't gonna be fully white. Because also my school, I don't know if some other people's school does this, but but sometimes it's like a requirement to wear a white dress. For mine, it's not. So it's gonna have purple in it and a little bit of green. And then I'm going to do, hopefully, because I'm worried, I'm kind of worried about, college and being able to fund it. Not that my parents would help, let me put that out there, like my parents would help, but I kind of feel bad. And so I think I'm gonna do teaching fellows. So you do not know, I want to go be a high school art teacher. Because I want people to have a safe adult, and I don't want what happened to me happen to other kids. Like, if I can prevent that, I'm going to. But also at the same time, the reason I'm going into education is because of my granny. She valued education and she loved teaching little kids, and my Gigi means the world to me. And unfortunately she's not with us anymore. She passed away when I was 10. But I want to do this to make her proud, Sorry, my sister is in education and she's a teaching fellows. She's gonna go into childhood education. I think it's childhood education. Elementary education? I don't remember the thing. And then my mom was a high school history teacher and now she's an admin. So I have people in my family that were, so I'm working on that because I need to get my SAT up so I can go into the college that I want to go to, which is the same college my sister goes to. And so hopefully I can get this teaching fellows thing. And if not, it's not the end of the world, But yeah, I have to get this stupid UTI crap together. So I'm gonna go. I'll tell you what they said, maybe today, maybe not. I don't know. Gonna try to be more consistent, but life is life sometimes. Okay, so today's the next day because I did film as soon as I got home, but I was very upset, and so I want to make it very known that I have dealt with these doctors like this before. I have just gotten lucky to find my group of doctors that work together and that understand me and that listen to me. I have, the last time I've had to deal with something to a degree of someone not listening to me was when I was in the hospital earlier last year in October. But this was when this all first started and when I was 12 and I just got told I was crazy and it was all in my head. So, and I'm sharing this story even though it's a bad story because, all my other doctor's appointments have been, pretty good. My doctors listen to me. I also want it to be known that this was not a doctor I was going to go to. It's not the doctor that my doctor referred me to. The only reason why, when we called after the referral to get it scheduled, the only reason why we chose to go with this person is because they could get me in sooner. We should have waited until July, but we didn't. So we get there, it's a urologist. They're gonna have you pee in a cup. Alright, that's just how it's gonna go. because urology has to do with like bladder, like, because nephrology has to do with more of your kidneys. Urology is bladder and that stuff. So get there, I do the sample, and then when they go, like, call me back, they do a quick ultrasound on my bladder just to make sure that it's emptying all the way. And my dad took me. If my mom took me, it would have been very ugly. And my dad did not want to make a scene with this person because he did not want me to, like, he could tell I was already like, are you serious right now? But he did not want to cause me any more, like, stress. So she comes in, and it's a nurse practitioner that we ended up seeing, not a doctor or anything. And already she has this stance and this attitude and just this look on her face that I know way too well of, like, I've already decided who you are. But I'm like, maybe I'm wrong. I can always be wrong. I hope I'm wrong. And she comes in and she's like, so what are you here for? And firstly, I say, I've had POTS since I was 12. I was diagnosed with lupus about a year ago. I just want that to be known, first off, because lupus can do with your kidneys and give you UTIs and bladder infections and all that lovely stuff. And then I go into, the past, like, every 15 days, I'll get sick, won't be able to eat anything for a whole day. Then the next day, my bladder starts cramping. We go to the doctor. The first time we went, like, I had a bladder infection. And the last few times, they've just given me antibiotics, like 2 different rounds of antibiotics. And before I can even finish my sentence, she goes, well, you need to not take those anymore. And in my mind, I'm thinking maybe she's saying that because, like, my urine this time was fine. Not once does she ever talk about my, like, the urine they took that day. Which is weird. It's weird. Last time I went to a urologist, they were like, this is what your urine said today. It was okay. Like, none of the stuff. They are supposed to talk about it. I mean, that's literally, anywho. And she was like, they're just giving that to you because they don't know what else is going on. And I'm like, yeah, like, my doctor explained that to me, but my doctor knew that, hey, you're getting sick. This isn't going to kill you. Let's give you this as we wait for the culture to grow. And each time, and I told her, I was like, the past 3 times, it has been, contaminated. And she goes on to say, well, that's just normal for girls. And it's just skin cells and all this stuff. And I'm like, okay. And I'm like, these 2 things, very consistent in my urine for about a year. One thing that the last time I had urine done was ketones in my urine. I've never had ketones in my urine. And so I said, hey, look, that was in there. Like, I knew that. And she goes, well, most urologists just don't know how to read this stuff. And I'm like, okay. And I'm looking at her. And then she pulls up my urine. She's like, because most urologists don't know how to read this stuff. And as she's pulling up my urine, she's like, this could be just because you're dehydrated. I think you're just dehydrated. I looked at her, I didn't even let her finish that sentence. I said, there's no way I'm dehydrated. I have POTS. I drink 2 to 3 liters a day because I have to. And then she goes, oh, Well, good for you. And at this point, I look over to my dad because I'm thinking, you know, what is going on? Like, are there cameras somewhere? Am I crazy? Am I hearing this wrong? I look over at my dad, and he's just like sitting there about to lose it on this woman. And I'm like, I don't know what to say. And my dad goes, our kinesiologist that I talked about in the beginning of the video had said that there is bacteria in her bladder. And the reason why I never said anything about that doctor is because there are certain doctors who don't believe in like the holistic stuff and don't really see like that doctor as like a real doctor. My rheumatologist does, my whole team, and this person was not a part of my team, was not a part of the same medical place, because my team of doctors is in another state, and they, like, my rheumatologist, like, can I talk to that doctor, because I want to see what his opinion was. So, like, I wasn't going to mention it because this woman was already very, like, attacking. And my dad says that, and she's like, well, there's no bacteria in her bladder. And I'm like, well, first off, there is, certain bacteria that does not grow in like a urine sample or in a culture because it has to come straight from your bladder. That is what a scope is. It's to look in your bladder, but it's also to get a sample of your bladder, because there are things that it's not going to show up in a urine test. And I'm like, oh my lord. And my dad goes, like, he suggested her getting a scope and getting a sample done. She goes, oh, you don't need that. You're just being, like, you don't need that. Like, you're just dehydrated. And I told her again, I'm like, I'm not dehydrated. I drink water. I can't be. If I'm dehydrated, if my blood work and my urine is saying I'm dehydrated, something is wrong and you need to fix it, basically. I didn't say that. I was trying to stay very respectful this whole time, but I was so frustrated to a point where I was shaking. And finally I'm like, well, the reason why we're here, well, first she goes, before I even say this, she goes, so were y'all referred here? Did you just, like, first off, yes, we were referred here. Do you think I just looked up your name and thought you were the best one of the options? No. That's a little mean, but anywho, and I go, look, I have been throwing up consistently every 15 days to a point where I am hacking on absolutely nothing. I don't have an eating disorder. I've been trying to eat. I haven't changed anything in my, diet. Haven't been eating anything I'm not supposed to be eating because I do have a crap ton of allergies. I'm not eating anything I'm supposed to be, like, I'm not supposed to be eating. I'm hydrating. I can't go to my PT appointments because of this. And if I have a UTI and they suspect I have a UTI, I cannot go in a pool, because that's what my PT appointments are. And I'm like, I can't function without going to these appointments either. And I go on to say, and my gastrologist, who also wanted a scope done and also wanted a sample done, is worried that all this throwing up and me not being able to eat for a whole day, I'm going to lose weight. I tell her straight up, hey, like, last year, I was having not the exact same problem, but I was having an issue with POTS and lupus of where I was nauseous. and I could not eat, and I almost got put on a feeding tube. Like, I was 5 seconds away from being put on a feeding tube. I do not want to go down that route again. We need to figure out what is going on. This is why we came to a urologist. And she goes, well, because you're 17, I don't think they can do the scope. You're probably going to have to go to pediatrics and get a scope done there. You're going to have to do the same thing we just did right now, which was talking, which wasn't really talking because it was like talking to a teenager who was like the mean teenager who just decided to go into healthcare because that's all she knew how to do, or she thought it would look fun or whatever. I'm very like mad. I'm more cooled off than yesterday, but I'm still very pissed. And do the whole thing again, and then they have to decide whether or not to give you a scope. And I'm like, I am throwing up every 15 days. And she's like, well, I can go ask. She's like, do you want a female or male doctor to do the scope? Because I have to go ask them. And I'm like, well, I would prefer a female. But if a male is going to get me in quicker, I don't really care at this point. And she's like, well, I'll go ask this doctor who's there for 1 week out of a month. If she can do a 17-year-old. And I'm like, okay, fine, whatever. She leaves the room and I look at my dad and I'm like, does she think that, like, I go to doctor's appointments because I want to be sick and I want to have, like, I don't do this for fun. It's like, if I could never go to a doctor again, great. I do not do this for fun, and I do not fake what I have to go through. And then she comes back in and she's like, so do you need anesthetic? Like, they're gonna numb the area and it takes like 5 minutes, but do you need to be like, but you're gonna be like awake? Do you need anesthetic? And I'm like, no. I was like, I think I'll be fine. And she's like, okay, so we're gonna go up here, we're gonna check you out, and then you're gonna talk to the doctor. So at this point, me and my dad don't even know like what's going on. We don't know if I'm getting it done that day. We don't know if we're just scheduling it. And so we pass the door to the lobby, and then they tell us, you need to go sit out in the lobby. So we go sit out in the lobby. It's been about 15 minutes. There's this other couple that's been out there for 15 minutes too. So by the time that, like, it's been 15 minutes for us, it's been about 30 for them. And my dad goes up and he's like, so are we waiting for, like, to schedule it, or are we waiting for the actual procedure? And the front desk lady goes, oh, you're waiting to schedule it. And my dad's like, we can't do this over the phone. Like, this is ridiculous. We can't do this over the phone. And the couple, like, says, are you waiting for, says the doctor's name. And Dad's like, yeah, apparently we're supposed to schedule something, but, like, and she goes, yeah, they told us it'd be an hour to schedule it. And Dad was like, I'm not waiting here for an hour. And he goes, like, we had a very rude nurse practitioner who didn't want to listen to anything. And I don't want to waste my time at this place anymore because you didn't listen to my daughter. Because, I mean, he was mad because he was like, we came here because he's seen me get, like, it's bad how, like, much I've thrown up and have gotten sick. The last time I couldn't even hold myself up. I was still throwing up. And I don't sweat, but it looked like I had put half my hair in, like, the shower. And I couldn't eat or drink anything for 24 hours after because I kept throwing it up. Or I did not have the energy to do it. So, like, he's mad. I'm mad. I'm sitting in the chair trying not to cry because I'm that frustrated. Because I cannot believe I had that conversation with a woman, like, with this grown woman. And so finally they get my dad's number and they're like, we'll call you. And we go out, the couple goes up and like is doing the same thing we did. Because that was ridiculous. And I get in the elevator and I'm like, I cannot believe I just had that conversation with a grown adult. And then I had to talk to my mom about it, and they're gonna, like, my dad's gonna fill out a survey about this woman, because that wasn't just like a bad day, that was how that woman was, and I am sugarcoating the crap out of this, because no one should be treated like that. I don't care who you are. No one. And no matter how bad of a day it was, you should never treat somebody like that. Like, I was referred to a urologist for a reason, and it was because they could not figure out what was going on. And so my mom is gonna call him and be like, hey, she'll first figure out the whole procedure situation, and then she's gonna make sure I don't see that lady again. Because I never want to see that lady again. That was insane. And unfortunately, it happens way too much. And again, I'm sharing this story because it is the it's the majority of what people have to go through who are chronically ill. Because just because you can't see something doesn't mean it's not there. And just because you can't feel the pain, or the person who is in pain isn't complaining about it, doesn't mean they're not in pain. I live with pain 24/7. The lowest it goes is maybe like a 6 on the 1 out of 10 scale. I'm not going to complain about it all the time because that's annoying. Who's going to complain about being in pain all the time? Also, you complaining about it doesn't do anything. Like, my 10 out of 10 pain, I'm not going to cry because I've been in there before. And I can't stand the doctors who see, especially, it'll be like, because there is, the woman's health care is a joke. There's no doubt about it. I can't speak on, teenagers that are, like, teenage boys who may be going through this. I don't know how that experience is. I can say maybe it's probably very similar because you're going through puberty, and they might say that it's just your hormones are imbalanced. But I can say that women's health care is so much of a joke because they have seen that I am a female and that I am 17, 16, 15, 14, 13, 12 years old, and I'm going through all this stuff, but my labs are fine, or my labs are abnormal, but not too abnormal, because I've been told that. What? And they'll just say, oh, it's just anxiety, or you're just doing this for attention. My thing is, if you do not want to actually help somebody, or you don't want to listen to your patients, or do anything like that, do not do that. Like, don't go into healthcare. If you don't want to deal with people, don't go into healthcare. Same way, if you don't like kids, and you don't want to deal with kids, don't go into teaching, or anything that has to do with kids. I'm still very shocked that even happened. I'm going to, I don't know what is happening after this at this point, but again, I share this because this is 90% of what happens. And I got very lucky with my team of doctors. And, no one should have to go through that. And no one knows what really is going on with your body except for you. And if you have gone through that or you're going through that currently, I encourage you to advocate for yourself as much as you can. Even if you think you're being mean, advocate for yourself. Because at the end of the day, it's your health and it's your life that you're going to have to deal with. And you're going to have to try and go to school and go be with friends. And you're going to have to pay for that because at the end of the day, your doctors should be doing their job. And if they're not, it's okay to push. Because it's between their feelings and your health. And I've gone to the point where I don't care about their feelings at this point because I have to deal with not just my health, but how my health affects my mental health. Like, we're not doing this. And I highly encourage anybody to advocate for themselves and not be scared to. I wish I had a better update, and I wish I had an answer to what was going on. But I do feel like that needed to be shared again, because that really is the 90% of doctor's appointments. I'm gonna leave that here. I hope you all have a fantastic day. This video is going to be a little long and I am so sorry. I am going to try to be more consistent while filming, but life does happen. But I hope you all have a great rest of your day.